Chronic migraine puts the brakes on my life. I had this trajectory, I had this idea of what I was going to do, and it completely halted it. I'm here today to share my story about my experience with BOTOX chronic migraine.
Let's roll.
I'm Evilise Rivera, and I'm a BOTOX for chronic migraine patient. When I was growing up, I was very healthy. I never even got a cold. But then out of nowhere, I had a migraine attack about a year into being active duty Air Force. I wasn't able to just text my supervisor and lay in bed in a dark room. The protocol was go to the emergency department where they make the call whether you are too sick to work. Having these people make decisions for me and say that I am sick enough, that I am impaired enough, made me question my reality. Like, am I really feeling this? Is it really that bad? The most hurtful aspects of all of this is not being believed. I completely stopped using the word headache because it does not do what I'm feeling justice. I was always so excited to be around people, but it kind of made me a hermit. Migraine attacks, they're random. I can't plan around it. I was a person looking to be diagnosed. I wanted to know what was wrong with me because I was afraid that it was a tumor. I was afraid that it was a cyst. I had all these very scary things in my mind. I had to wait till I was at my permanent duty station to finally see a specialist. The neurologist came in, took one look at me and was like, "You have chronic migraine." So I kind of found myself at a fork in the road. Do I keep putting myself in these situations, or do I seek out treatment options for my migraine attacks? I had appointments with neurologist after neurologist, CT scans, MRIs, blood work. I had so many medications thrown at me. It took me about 4 years to find a neurologist that I was comfortable with. The first appointment, he walked in, he was smiling, he looked at me, and he was like, "Well, have you heard of BOTOX for chronic migraine?" I definitely heard of it, but I had this idea of what BOTOX was in my head, and I just felt like maybe that wasn't for me, but he sat me down and he explained that he would give me 31 injections in your head and your neck, and it would take about 10 minutes. The first treatment, it's not as scary as you think. It was tiny little pinches. My doctor told me that sometimes it takes a couple of treatments to start to kick in, but in my case, it started working after the first treatment, and now I have fewer days with headaches. So be patient and stick with it because it's worth it. I get this done every 3 months, 4 times a year. It's like going to the grocery store or going to the gym. It just has been so ingrained in my routine. This whole experience has taught me to advocate for myself. I didn't take no for an answer sometimes. Nobody cares about you more than you care about you. And especially being a chronic migraine patient, you are the one going home with the headache pain. So if you're suffering, I know how you feel right now. I know how discouraging it can be. Talk to your doctor, advocate for yourself. BOTOX has made a real difference in my life. I can't tell you how grateful I am.
And that's a cut. Let's hear it for Evilise.
Indication: BOTOX, onabotulinumtoxinA, is a prescription medicine that is injected into muscles and used to prevent headaches in adults with chronic migraine who have 15 or more days each month with headache lasting 4 or more hours each day in people 18 years and older. It is not known whether BOTOX is safe and effective to prevent headaches in patients with migraine who have 14 or fewer headache days each month, episodic migraine. Important safety information. BOTOX may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks, after injection of BOTOX. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, and trouble swallowing. There has not been a confirmed serious case of spread of toxin effect away from the injection site when BOTOX has been used at the recommended dose to treat chronic migraine. BOTOX may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of receiving BOTOX. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not receive BOTOX if you are allergic to any of the ingredients in BOTOX. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rhimabotulinumtoxin-B, Dysport, onabotulinumtoxinA, Xeomin, injected, Juvo, probotulinumtoxinA-XVFS, Daxxify, daxabotulinumtoxinA-LANM, or Letybo, letabotulinumtoxinA-WLBG. This may not be a complete list of all botulinum toxin products. Have a skin infection at the planned injection site. The dose of BOTOX is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported, including itching, rash, red itchy welts, wheezing, asthma symptoms, dizziness, or feeling faint. Get medical help right away if you experience symptoms. Further injection of BOTOX should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of BOTOX. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, have weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, and any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if BOTOX can harm your unborn baby, are breastfeeding or plan to. It is not known if BOTOX passes into breast milk. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Using BOTOX with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received BOTOX in the past. Tell your doctor if you received any other botulinum toxin product in the last 4 months. Have received injections of botulinum toxins such as Myoblock, Dysport, Xeomin, Juvo, Daxxify, or Letybo in the past. This may not be a complete list of all botulinum toxin products. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinner. Other side effects of BOTOX include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, eye problems such as double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes, drooping eyebrows, and upper respiratory tract infection. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see BOTOX full product information, including boxed warning and medication guide, at www.rxabv.com/pdf/botox_pi.pdf. If you are having difficulty paying for your medicine, AbbVie may be able to help. Visit abv.com/patient access support to learn more.